Bob. We talked about AFib last time a little bit. The CPAP machine helped a little bit because the increased oxygen, but then you had a procedure done because that's not sufficient. What is that procedure?
Yeah, it's an AFib ablation where they go in to a section of the heart and they singe it and they correct the amount of AFib that you're experiencing. It doesn't totally change it all, but it cut it down to a very reasonable point.
So, according to your medical history, you have very slow heartbeat, sometimes a drop to 40 something, and then you have AFib. Which one is the first? Because I have very low heartbeat. I have 48 sometimes, but I never have symptoms. And just sometimes I feel tired, I need to lie down. But yours, which one come first, the AFib or slow heartbeat?
Well, the AFib was detected earlier, so I had the ablation for the AFib episodes, but it didn't do anything. The CPAP machine and some medications that I was taking for my heart rate during the day was possibly 40 to 45 maximum. But at night when I went to sleep, it dropped down to like 23, 25. So there was a day when my cardiologist put me on a heart monitor so that he could get a record of how low my heart rate was going when I was sleeping. And about 3 o'clock in the morning, they monitor the heart rate. I got a phone call from the person that was monitoring my heart rate. They said it went down to 23 degrees, and he contacted my doctor, and the doctor scheduled me to have a pacemaker.
So let me ask you. So the procedure you did for AFib, how long it's working before you get a pacemaker?
Yes, right.
How long?
It's kind of like two issues.
Yeah.
I think there might have been a year in between the AFib surgery and
what is that
ablation. It's ablation. Yeah.
Okay, so ablation basically just kind of erase that abnormal circuit in your heart, but it only lasts for a year, and then you have to switch to.
Well, it goes on. As far as the ablation, as far as the AFib was corrected. So I had very short episodes of AFib. When I had the pacemaker put in, I also go every 3 months and have it interrogated, where they put a device on my pacemaker and they can see the amount of AFib episodes that I've had. So they're monitoring my AFib condition by using the pacemaker device, and I go and see somebody to interrogate it, and they look at the amount of episodes. I may have, from let's say 1 month to the 3rd month, when I go for the test, I might have 5 episodes of AFib, none of them lasting longer than like 5 seconds or 10 seconds.
So what is the pacemaker really do? Is that like when your heart rate become irregular, fast, it reset to the normal, or because your heart rate dropped too low? What is this pacemaker? My understanding, usually the pacemaker reset heart rate around 60 for people who have higher heart rate, but yours is lower. So what is this machine do for you?
Well, for me, it increases my heart rate. So my heart rate on the with the pacemaker is 60 beats, as you said, and very seldom do I get active enough to make it higher than that. Only possibly maybe 5 points, but not much. But it does, you know, when I go and get it interrogated, they kind of turn the pacemaker off to see what my normal heart rate would be. And it might be like 30, because during the day, it's, so with the pacemaker, it keeps my heart beating at 60 beats per minute, and that also helps the energy level, and it's nothing to worry about. It's a small little bump on your chest, and in fact, the batteries that they use are like a 10-year battery, and I'm due to have those replaced this summer. That's how long I've had this particular pacemaker.